Hello and welcome to Laerdal's Home to You video roundup series. My name is Will Trapaskas and we're here in sunny Los Angeles at IMSH 2022. On day one of Home to You with Laerdal from IMSH, we will be bringing you some key simulation market trends, as well as an interview with Carol Renfro from Auburn University, SonoSim, and conference attendees. We'll also be highlighting a few products from the Laerdal booth. Hello everyone, I'm here with Carol Renfro. She is our first key opinion leader that we're going to be interviewing for the Home to You series. Carol, do you want to give a little background and introduce yourself?
Sure. I'm Carol Renfro from Auburn University School of Nursing. I'm an assistant clinical professor and the Nursing Resource Center coordinator, which I coordinate the skills throughout the curriculum for the Auburn University School of Nursing.
Great, thanks. I think one of the first topics that we wanted to discuss was kind of what's going on with the nursing shortage in the United States and also around the world.
Yes.
Do you think simulation has an impact on that or can have an impact on that in the future?
Absolutely. I think the biggest thing for everyone is, of course, people are facing stress, burnout, workload. If you have realistic expectations, and you can set those expectations through wonderful simulation and clinical experiences, I think it really offsets some of the impact that people have. But it's very different sometimes out there in clinical practice than what you see from being a student. And if you can help prepare people for those challenges that they're going to face, the better you can do that, the more you're going to retain new nurses out in the field, that they're the challenges that they face. We can really help that by preparing them. And that's what simulation does so beautifully, is recreating those challenging clinical situations and having people have to think through how best to respond to that while keeping themselves healthy and well, and then doing the best they can do for their patients.
Sure. So you just touched on, I think, a great point, creating those difficult situations, preparing nurses for really the difficult aspects of the actual clinical, real-life scenarios. Is there any kind of tips or key learnings or anything you could share that may help a professor or even someone teaching a nurse to help better prepare their students?
Honestly, well-designed simulation and skills training, when we pay very close attention to those best practices out there to guide us in both design, the implementation, the debriefing, and the wealth of that learning that we can provide using great tools that we have, that Laerdal provides, that other agencies have out there that we've shared together as a body of knowledge. If you use those well, you can design beautifully customized things for your curriculum. And you can look at that data, places where your students are struggling to get those concepts, customize your options that you can provide for them to help them get where they need to be as a new nurse. And all of that data really can drive a beautiful program that can truly layer on every aspect of those challenges that you might not get to see out in the clinical environment as a student, but you will be faced with once you become a new RN. So all of these tools just fit together beautifully, and when done well, it can be everything to get them prepared for what they're going to face. Great,
thank you. And I think another thing that we wanted to touch on as well is, we're early on in 2022. Is there any kind of key topics or, market trends that you've seen or may emerge over the next few months as we move into 2022?
I think just, again, facing those shortages of clinical placements also become a very big challenge for schools because of those challenges, short staffing, and again, having strains put on the healthcare environment is creating an additional layer of that shortage. Not only are people having staffing issues themselves, but they're worrying about the safety of bringing students in that environment. So we're challenged with those things more and more. And that's where simulation really helps us to be able to bridge that gap between what's available out there to train students with and how to get them the valuable clinical experiences that they need. So I think that trend's going to continue and only really increase as we move forward.
Great. So Carol, have you noticed simulation playing maybe a bigger role in some of your teachings due to the COVID-19 situation and the pandemic in general?
Absolutely. We've had situations in which hospitals have had to stop allowing students in, and we've had to shift for more simulation experiences because of that. But when well designed and utilized, again, adhering to those standards of practice, honestly, we can create beautiful learning experiences where the students can be challenged and actually get the salient points that we need them to get and retain from those simulation experiences. And we've had to do that more and more with the pandemic. And I see that honestly being our world. You know, this is our new normal and this will continue to be. And so that's where we've got to lead with this, and we've got to continue to understand how best to utilize this great technology and prepare people for what they're facing. So absolutely.
From a student's point of view, the impactfulness of being involved in a clinical simulation, do you think that provides more of a benefit for the student in their learnings before they get out?
Oh goodness, yes, because they experience those same emotions and those same conflicts and those same challenges where they really don't know how to respond. And with everything is better with rehearsal and practice, everything. And so when we can allow them to do that and then have those really deep, rich conversations about that and how this will affect you when you get out of school and with the clients out in the environment, it's everything for them to be able to understand how to respond. And simulation really does that beautifully for them and allows them to have those rich conversations without worrying about the safety of others or in any other way. So it's a psychologically safe learning tool, and it is absolutely clinically exactly what we need it to be to prepare people. So, yes.
Great. So is there anything at IMSH that you're looking forward to see or learn about?
Absolutely. We are really expanding into the use of AR and VR in learning, and what we need to capitalize on with that emerging technology, which I think can add so much to experiences, and also wearable technology for standardized patients to add that other level of realism and learning those rapport concepts and the psychological aspects of taking care of patients, which is critical and sometimes the hardest to teach and to learn. So that's really exciting, and we're seeing a lot of that out on the vendors and that kind of thing. It's exciting.
Great.
Exciting times.
Yeah, thank you. So I think we're going to wrap up here, but I just wanted to say thank you for your time, and I look forward to seeing you out on the exhibit floor at IMSH.
Great. Thanks so much.
Thank you.
You will feel a sting when I insert the needle in your vein.
I really hate those IVs. Please get it on the first try.
Yes, I understand.
Hi, I'm Julie Redmond, and I am a lead educational services specialist with Laerdal Medical. And I'm here today to talk to you about the next generation of vSim for nursing. This was developed with our partners, Walters Kluwer, to really develop those practice-ready nurses with high clinical reasoning skills. You know, we know that by 2030, there's going to be a need for about another 9 million nurses in the workforce. And so nursing schools are under more pressure than ever to provide those opportunities for nurses to have those skill practicing opportunities. And they aren't able to get them as much as they need to. And so that's one of the great things about vSim. This next generation of vSim was created in collaboration with nursing educators. And so what has happened with this next generation vSim is that it is higher and gone further than its predecessor. It has more realism than it did before, and just allows for a more robust opportunity for the simulation student to have a great learning experience and really develop those simulation skills. It also has soft skills that has audio and visual responses that the nurse can respond to from the patient directly. And that really, again, just helps them improve those clinical reasoning skills. In addition to that, there's another new component called the S-bar, and we all know how important the S-bar is. And what that does is it allows the learner, again, to just have a really good communication with the patient and with their team members when they're handing off a report. So as you can see here, the next generation of vSim is available on a tablet. And what's so great about that is it allows the learner to leave the classroom and train virtually anywhere. It's going to be available for fundamentals and med-surg and nursing education, and it is available in the USA market. And it will be available coming up in the coming years in 2022 and 2023 for the EMA and AP market. The other thing that I want to talk about is our nursing and simulator, Geriatric. What's so great about her is she has this new level of realism. And it's so important for our learners to identify with the population that they're working with. And this really gives them that emotional investment that they need for that with this high fidelity mannequin. So I just want to take a second and look at her features. So she's got this great gray wig. She also has cataracts around her eyes, and she has the arcus senilis pupils. In addition to that, she has aged face skin, neck skin, back skin, front skin. Her hands and her feet are also aged, in addition to her genitalia. And her teeth also have an aged look to it as well. And you'll notice right here how beautiful her clavicle is for an anatomical landmark. So it's important to know that she comes in this medium tone right here, which is the one that you see. And then she also comes in a dark tone. And she comes two ways. She comes as a full component, all set up for you. Or you can use her as an add-on for the nursing and simulator that you may already have as an add-on. So those are all the great things about this mannequin, and she has lots of great opportunities to work with that geriatric population in a way that you never have before. Thank you so much.
Hello everyone, I'm here at the SonoSim booth with Lizette. Lizette, I just wanted to quickly ask you, could you provide a quick background on who SonoSim is and their mission in the simulation market?
Yeah, absolutely. So SonoSim, we are an ultrasound training company. We were actually founded by Dr. Eric Savitsky. He is an emergency medicine physician at UCLA. And as many people know, emergency medicine were really the true kind of early adopters of point-of-care ultrasound. But he realized early on there's a lot of barriers that come to trying to implement ultrasound training as well as creating the adoption. Some of those barriers are going to include, having access to a patient, and not just any patient, a patient with pathology, having time with a qualified instructor, having access to an ultrasound machine, and really having all three of those things come together to have that great teaching moment. On top of that, you have barriers to adoption, so the ability to have access to refresher training, the ability to standardize the training across all your learners, the ability to just practice until mastery. So what he realized, when he was creating SonoSim, what he was trying to do was to overcome those barriers. So through our training solution, we're really able to kind of overcome a lot of the things I just mentioned. We do that through the SonoSim ultrasound training solution, which includes access to online didactic courses with knowledge assessment. And then from there, they can move into our SonoSimulator to practice the image acquisition and interpretation piece from a large library of real patient cases. All of that work that the learner is doing within that platform, it is saved, it's trackable so that instructors and administrators can review the progress of the learners, give them feedback. And then from there, they can use our SonoSim live scan technology that really kind of brings it all together, right? They've got the prerequisite knowledge needed from the didactic courses. They have the image acquisition and interpretation from the SonoSimulator. But then what do they do with all that knowledge, and how do they apply it towards medical decision making? And that's something that SonoSim LiveScan can help them with.
Awesome, great. And I know we're early in 2021, but moving into 2022, are there any significant market trends that maybe SonoSim or your team are focused on?
One of the things that we're really excited about for 2022 is our live scan technology. So probably similar to the LSUS 2.0 product that the Laerdal team is familiar with. This year we're going to be talking, or this weekend specifically, we're going to be talking about how to integrate physiologic variation in terms of being able to adjust like the patient heart rate, the respiratory rate. Those are some of those things that we're going to be showcasing this weekend, so I know we're excited about that.
Really appreciate your time, and thank you for helping out with this.
Thank you so much.
Thank
I
you.
appreciate it.
Yeah, very enjoyable, having a lovely time, thank you. I'm mainly interested in how to develop our three aspects really, but one is the practical skills so that we can improve our intubation training for anesthesiologists. And another one is improving our team training and leadership, possibly using virtual reality simulation. So the third goal is to find out more about virtual reality. I think VR is huge. I think that's where it's going. Just looking around the exhibit hall, there's so much virtual reality. For something that wasn't here 5 years ago, it's quite impressive. I think it's finally moving away from donning and doffing PPE to actually going back to, crisis simulation, to teamwork training, to all the things that we love to do.
Very much. It's been really exciting so far, and it only just started. New technologies and making connections with others with interests similar to mine, which have to do with simulation and patient safety, which is a big emphasis this year. Patient safety and outcomes, especially since simulation has become even more important during the pandemic as far as the power and the applicability of simulation, but so many different applications, so I'm interested in learning more that I can take home. I think it's looking good. I think I've talked to some people already who are getting new funding to support their simulation programs. People are starting to see the importance. People in healthcare systems, not only in education, but also in helping fill gaps, as we just heard from Dr. Frampus, about filling gaps using simulation to improve patient outcomes.
It's a blast to be back in IMSH. I'm really glad to be back to seeing a lot of the people I've been working with, a lot of the people I've been learning from for years, and I'm just so excited to be back in this environment. I'm hoping to learn more about a lot of process management work. How can we start doing and integrating more products inside of the hospital to take care of all the new things that are happening inside of hospitals that we need to kind of worry and care about now? Oh, definitely AR, VR is everywhere. That is going to be like the number one thing right now. I think that it's just going to continue to grow. We're going to see more AR, VR. We're going to start looking at new ways of trying to integrate like actual products that people are using on a day-to-day basis, like ultrasound, into a lot of our high-fidelity mannequins, all of these kind of things.
This concludes day one of Home to You with Laerdal from IMSH 2022. Be sure to tune in tomorrow for our day two roundup. Thanks for watching.